It's our Key Population Summit. Let's make it work for us. Let's make it work for our communities. And with that, ladies and gentlemen, and everybody else in between, including myself, in my non-conforming gender identity, welcome, and we're looking forward to a very successful summit.
You think that this health summit is great in gathering not only the people that work with key populations, but also the people that represent key populations itself. And together, what we're doing is collaborating to make actionable plans to strengthen services for healthcare for key populations.
They are kind of a neglected, community. And we know that the HIV prevalence, continues to remain high amongst the key population. So we felt that it is important to bring all the stakeholders, to discuss on strategies that need to be, put in place.
We need to empower the communities. Our communities, they don't know anything. That is why they are engaging in risky behavior.
Prioritizing gender-affirming healthcare, getting access to hormones and surgeries, those are things that I feel are important in addressing, equitable healthcare for our community.
There's so many intersecting issues and synergies within our different key populations, and I think strengthening that the collaboration and efforts will really result in, I guess, policy changes and, effective responses to the issues that key populations face.
There is a greater demand for our services, but in terms of the funding that we get, it may not be adequate for us to scale up our programs. So we are confined to certain areas as prescribed by the funder. At times, when it comes to key populations, government has somehow abdicated that role to donor-funded agencies instead of it being fully involved.
We want to see government committing resources. This includes your harm reduction programs. If the funding can be cut, it means those programs will come to an end. But if government can support, then at least we're likely to see some kind of continuity.
Of course, we have to review policy that we identify that's emanating from government, and so we review it to make sure it's human rights friendly.
As long as key populations remain criminalized, there will be no data for them, because they will not come forward because of stigma and discrimination and violence.
I haven't quite been in an environment where key populations are actually in the room with us. And I think it's because the Department of Basic Education doesn't have an existing mechanism of engagement with key populations. And so what this summit has done was to open up those pathways of engagement for us.
It has been a success. We are able to network, we're able to understand what other programs are doing and offering to key populations, and we also identify areas of collaborations going forward. So for me, it has been a success.
The fact that we have people like Department of Basic Education here, Department of Social Development, we have the Human Rights Commission here, we have, mayoral committees here, just shows that people are paying attention. People understand the key population, facing that and addressing the needs of them has the greatest impact for public safety and for public health in general.
The really important thing about this is to make sure that we translate our findings, our best practices, into actions.
We know what needs to be done when. We also know who needs to be involved, but we need to now coherently coordinate our efforts. But we need civil society not to relax. It's not time to relax. In fact, you need to stand up collectively in solidarity and fight a little bit more. That's what we need.